So thank you everyone for being here. My name is Amy Castles, and today we have the pleasure of interviewing Dr. Willie Villareal. So Dr. Willie Villareal and his wife, Kat Villareal, are co-founders of Core Health and Wellness in Conroe, Texas. They focus on longevity, hormone optimization, peptide therapy, taking the root cause approach to a lifestyle and personalized care. And the goal is to help patients restore energy, improve their metabolism, and truly optimize how they feel and function long term. Dr. Villareal has been my doctor in hormone replacement therapy, bioidentical hormone replacement therapy, since 2019. He's been the absolute best. So thank you so much for being here and agreeing to hop on this Zoom and answer our third grade questions because we've got them.
Sure. Thank you for having me. I appreciate it.
Okay, so let's go ahead and get started. The first question is people want to know, what are peptides?
Yeah. So real easy. Peptides. I'll just go over what they're not, right? Because people don't know what they are, what they're not. So peptides are not steroids. They're not hormones. They're basically short chain amino acids. They range anywhere between 2 to 50, 2 to 100. Small linkings of amino acids, which are natural building blocks. They naturally occur. So, small chains of amino acids or peptides, the larger they get, they become proteins. So a lot of, peptides together are proteins. And a lot of people think they're new, but, peptides or insulin is a peptide. We've used that for, you know, 50 plus years. The ones that most people know about peptide wise now are all the GLPs, the glucagon-like peptides for weight loss. But think of them more, I like this term, think of them more like biological text messages. Okay, they're more signaling molecules than anything else. They're basically like they tell your body to do something that it already knows how to do, it just does it more efficiently. And so for example, like some peptides will signal your body to increase growth hormone. Some of them will help you with fat metabolism. Some will help support healing and recovery and inflammation. So they all do different things, but peptides just basically work by optimizing your own body's natural processes. It's the easiest way to explain them. And they can be a real powerful tool for like performance, recovery, and longevity. And we'll talk about that in a little bit. But it's not about replacing your biology. It's about enhancing what's already there. So that's the big thing about them.
Are we losing peptides as we get older?
We're losing the peptide's ability to work efficiently, and in some cases, yeah. I mean, we have over 300,000 peptides naturally occurring in the body, and we're just learning about what the majority of them do. That's why you're seeing so many new peptides on the market, and it seems like they're popping up, every week. But no, yeah, as we get older, I mean, everything declines.
Hmm.
But more so, it's not that so much that the numbers declining, which it does, but it's more of the actual signal to signal. We actually signal less efficiently, and that's where the peptides really help.
Now, peptides have been, obviously, they've been around for a very long time. And we have heard many stories of, oh, now different bodybuilders, fitness competitors, even professional athletes, back in the 80s and the 90s, they were using peptides. They just kind of kept it quiet because there wasn't really much talk about it. Who knows where they were ordering it from. But we're seeing a huge push of peptides now. Why? Why is that?
Well, because everybody's number one, the availability, um, social media. So just understand that, like in the past, it was a gym bro that you had to know. It was a gym
Mhm.
that you had to go to. Now, with social media, it's exploding, and so just as with anything, good and bad with social media, you get positive movement, and you get negative movement with social media. But I think it's a big push from social media, but also because so many people are into longevity, wellness, and they're seeing, and here's the thing is they wouldn't be growing so much if they didn't work. That's the
Right.
big thing is they work. They're safe when used properly, when sourced properly, and we'll talk about that. But that's why they're gaining popularity, is because people are actually learning how to use them properly. The sourcing is better. They're actually coming now from 503 pharmacies, which again we'll talk about. But I think honestly, the biggest thing is probably social media and the popularity. Now, that's you and I both know social media can be really, really good and really bad. It can give really good information, and it could give really, really bad information and negatively inform people.
I also believe that there has been a huge push because some major pharmaceutical companies decided to pick up a few peptides in the weight loss space, even
Mhm.
though they had been using them, it just wasn't really advertised
Mhm.
and put into a weight loss category.
Mhm.
And so we've seen the big push of two main GLP peptides come out, and we've seen significant weight loss. And a lot of us have kind of stayed back and we kind of watched for a while to see what would happen. And I think we're starting to notice a difference of when a large pharmaceutical company has their brand name on a product and prescribes a certain dose that you cannot adjust or
Mhm.
lower if they're giving you a pre-filled penner or pen,
And yeah. Yep.
and they're putting so much of that peptide in there
Mhm.
that yeah, people are having weight loss, but
Yeah.
they're starving their bodies and we're seeing those negative side effects. So we almost need to unlearn some of
Yeah.
those stories that we've heard, start back at the beginning, and let's re-examine how these are successful and a better way to use them. So we'll get into
Yeah.
more on that with the weight
Yeah,
loss.
so the thing that with GLPs is that unfortunately a lot of the negative issues that you're hearing with them are from the brand name, the Ozempic, the Wegovy. They come in the Mounjaro, the Zepbound that are in set dose pins.
Mhm.
You can't personalize or adjust those doses. Like I tell patients all the time, I said, I show them a pin and I'll say, look, when you get your dose in a set dose pin, that's it. If you inject it and you get nausea, oh well, I mean, you're stuck with that pin. Whereas when they come in a vial and you can actually like lower the dose and draw less,
Mhm.
they don't have a lot of the same side effects. And I think a lot of the side effects too are from improper counseling from the doctor. Like they just go to the doc and they just tell them, hey, here, you want to lose weight? Here you go. But they don't counsel them that they need to prioritize protein. They need to strength train. They need to do all the things to maintain muscle mass. So then they lose weight because they're in a calorie restricted diet, eating 300 calories a day, and then they blame semaglutide. And I'm like, it's not semaglutide. You're eating 300 calories a day. You're going to lose muscle and fat regardless of what you do. So a lot of it with the GLPs is just improper counseling and then improper product. So I think that the vials are a lot better. The compounded vials are a lot better for people because they can customize their dose.
Seen through the years, especially in the 90s, people going through starvation diets.
Mhm.
Early 2000s, we saw a lot of starvation diets. We got all these books coming out, people eating
HCG. Yeah.
oh, the HCG diet, all of that.
Mhm.
People were losing significant amounts of muscle because they were eating such a small amount of food. And
Mhm.
there is a way to use these
Yep.
GLPs while
Oh yeah.
eating a at minimum for a female, just at rest, 1,200 calories at
Yeah.
minimum. You want that. Hopefully you're getting more calories than that to feed your muscle, but there is a safe and effective way to have weight loss results from peptides without starving your body.
No, we see great results at our clinic because I have paperwork, I have information that I give them and they follow and we see great results with all of our patients because they're counseled properly when they're using it. And so we don't see the Ozempic face and the Ozempic butt and the gauntness and things like that that you see. And
Mhm.
that's what, proponents against GLPs are using as evidence, to say that, oh, well, the long term, we don't know the long term. Like, well, yeah, but we know the long term effects of obesity and diabetes, and those aren't good. So that's always my comeback to that is they always say, well, it's cheating. It is not cheating. One of the biggest mistakes that I've seen that has happened with GLPs is they put it in the little box of weight loss, and it's way beyond weight loss. So one of the things that I see with it is that it lowers the food noise, it lowers inflammation. I have had people actually like stop their, gambling because I've seen people stop their alcohol. I've seen people stop smoking with GLPs. And those are like, again, like with other peptides, one of the cool things with peptides is that they have a lot of positive unintended consequences. And that's one of the things that we're seeing with GLPs is that like it just helps with like food noise. Um, Full disclosure, I'm on a GLP. I started taking one just about 4 months ago simply because I didn't have a lot of weight. I didn't have any weight to lose, but I noticed that I always overate. My reason for taking it was, my wife said, "Babe, you eat healthy. You just eat a lot healthy." So like I never felt satiated. I would have, the joke at the table was my kids would be like, "Oh, there goes dad for plate number three." And it wasn't that I was gorging myself. It was just that like I just didn't feel full. And now I have that satiety cue and I don't have the need to eat beyond, when I'm full. And so it's just a really good tool.
I want to go back to hormones for a second. People
Okay.
are asking, can they take them together?
Oh yeah. In fact, you should
Yeah.
take them to like
Yeah.
like it's a 1 + 1 = 3 with peptides and hormones. Because it's again, without the hormones, you're missing the major component, and they're way more powerful, like way more powerful, molecules than just the peptides alone. But yeah, for sure, 1 + 1 = 3 with peptides and hormones.
Are they still discovering a lot of the benefits of GLP peptides aside
Oh yeah.
from just weight loss?
Oh, absolutely. Like I said, one of the biggest mistakes is that it's only for weight loss. I have people microdosing it for just inflammation in their hands, inflammation in their joints. There are GI doctors that are using it for improved IBS, IBD. And funny story, like I'm always hesitant, so when a patient came in, she says, "Oh, I shared that I'm a GLP with my GI," and in my head, I'm like, "Okay, here we go. What did he say?" And she goes, "Oh no, he was so happy that I was on it, and because he's seen so many good results with all his GI patients." Same thing that's going on with cardiologists. I have a cardiologist that's great. He's amazing. I refer to him a lot, but the reason being is because he's a very forward thinking, very well versed in nutrition, which I mean, medical school, 4 hours of nutritional training, 400 hours of pharmacology training. So very few, unless they actually take it upon themselves to learn nutrition afterwards, know anything about nutrition. So you go to anybody, any doctor, and be like, ketogenic diet is horrible for you. It's gonna, clog your arteries, and they don't know the first thing about it. It's just a trigger word. So there's a lot there, and that cardiologist, he's like he's putting everybody left and right on tirzepatide. So that's his kind of peptide of choice. But yeah, there's a lot of different specialists that are using the GLPs now for different areas.
So many people are aware of the GLP semaglutide, aka Ozempic, or tirzepatide, GLP, GIP, aka Mounjaro, and Zepbound. Those are the pharmaceutical brand names. But
Mhm,
there's another peptide that entered the game recently, and that's called Mots-C. And
mhm.
how is Mots-C different than the other two?
So Mots-C isn't going to be like a GLP. It does increase like insulin sensitivity. It really helps. I like to add it in or recommend it for a lot of my patients that have like pre-diabetes, diabetes, because it's going to increase that insulin sensitivity. And so it's more of we call it exercise in a bottle. In the research world, they call it's more like an exercise mimetic because it increases mitochondrial function and it just makes your mitochondria work more efficiently. So again, remember, peptides are signaling molecules. So MOTS-C is really good. And it's really synergistic, especially if you mix it with NAD. Those two are very, very, very effective together because they hit different pathways. And NAD, it's lumped in with peptides. It's not really a peptide. It's more like a coenzyme. It's a derivative of like vitamin B3, like it's a niacin derivative. It's a niacinamide. And but again, it's for longevity's sake, it's been shown to really, really like if you're 50 plus, by all means, by every single study, it's 50% of your NAD is just gone. Doesn't matter how healthy you are. And so it's one of the key, if you look at the work of like Dr. David Sinclair, who's one of the top longevity experts in the world, like he's huge on NAD, huge, huge, huge on NAD. But again, like with everything else, sourcing matters. But MOTS-C is more of a mitochondrial peptide and just really hits more of the insulin sensitivity pathway.
It's like almost like the movie Limitless. Remember it with Bradley Cooper? I
Bradley Cooper,
think
yeah.
I think they were. kind of copying the effects of NAD. It's like a
Mhm.
light switch going off in your brain.
The injection is extremely effective.
And we have many people on this Zoom and watching this recording that are very lean, already into fitness, but they're aging and their ability to recover has kind of diminished a little.
Mhm.
So, what would be the peptides that help with muscle recovery, maybe some muscle building support? I know lots of people who are in the gym constantly and their muscles will not move.
Yeah.
They are eating all the eggs, all the protein that they could possibly have,
Mhm.
still not seeing the muscle mass increase.
Well, so when people ask me if, okay, if I were to just pick one, because I mean, you can honestly, like, you can go broke, like, pick
Right.
using every single peptide. Okay. My own wife asked me the other day, okay, if you were to just pick one peptide, one right now, what would it be that has the most overarching umbrella? It would be probably the growth hormone peptides, which are
Yes, that's what I want.
morelin, tesamorelin. Sermorelin is really great. And here's the thing with for people to understand about sermorelin, that's been FDA approved for years and years and years. Okay. Even tesamorelin, that's been FDA approved for many, many years. It came under the brand name Egrifta, and it was originally developed in like the 80s, 90s for AIDS patients that were experiencing what we call um, basically muscle wasting cachexia, but also lipodystrophy, which is like an abnormal accumulation of fat in the gut. If you ever saw, you remember the old commercials of like the Ethiopian, kids where they're
Uh-huh.
very, very skinny with a big bellies. That's a lot of like ascites, like fluid and lipodystrophy. They'd get this fat distribution. AIDS patients would get that, but also because of the muscle wasting, the tesamorelin would actually help maintain muscle mass and bone density while taking away that visceral fat and belly fat. But tesamorelin with mixed with ipamorelin, that's kind of the better long term. And then you can sprinkle in other ones, Mots-C, BPC, things like that. But like just if you're gonna do one, I would say either sermorelin or tesamorelin, ipamorelin. That would be the kind of the go-to. And then you could go into any number of things. If you're in a heavy, heavy training cycle, I would say BPC, 157 with TB 500. That one is very, very effective. And important distinction because a lot of people, you see them touting BPC oral online. Okay, BPC oral is really good for gut issues. Very good for gut issues. Not so much for the systemic uh, joint recovery that you'll see with BPC injectable. The BPC injectable can help with gut issues, but not the other way around. You don't see as good of an absorption or response with a BPC oral systemically from you can a little bit, but not like you'd see it with the injectable. So for any kind of training, recovery, injury, acute injury, tendonitis, things like that. I had a American Ninja Warrior guy that had like a tendonitis in his elbow for like over a year. No matter what he did, whatever soft tissue work he did, microneedling, couldn't get rid of it. Put him on BPC, and it was gone in 7 days. Like it was gone right away. And those are kind of the stories that you hear now. Caveat that with if there's a structural issue, okay, if you have a rotator cuff tear, it is not going to heal your rotator cuff tear. You may get instant relief from the pain, from the inflammation, but if there's a full rotator cuff tear with retraction, I mean that's going to continue to hurt. If you have like tendinosis, which is like kind of a fraying of that tendon, then yeah, it could help and it could help rebuild. But it's real important to make that distinction because some people, think, oh, it's going to heal my rotator cuff tear. It's like, oh, um, that being said, I have people that like even today, I had a guy that has, I've had a rotator cuff for 20 years, and as long as I do BPC and TB 500, I can function. So, I mean, it has its uses, but just remember that with a caveat, if there's a structural issue, just be real careful with that. They may come back with, well, it didn't work well because you need to take care of, you may need to have surgery. you know.
So just to give a little quick recap of that, we have BPC 157 and TB 500. That is two different peptides combination and great for inflammation, recovery, um, uh, post-surgery operation, wonderful to help the body heal. Okay, and then we talked about tesamorelin and ipamorelin. That
Mhm.
one, that's a combination of two different peptides that stimulate the production of human growth hormone in the brain. That is the fountain of youth.
And I want people to understand, because I get this question a lot. Like, why just not use HGH? Well, here's a problem. HGH, it artificially raises your growth hormone statically all day long, all the time, and it can shut down what we call your HPTA axis. Growth hormone peptides don't do that. You inject them at bedtime. They make you pulse more growth hormone in your sleep, which is when you pulse growth hormone. Okay. And they have, like, say, tesamorelin has about a 38-minute half-life, meaning every 38 minutes it's halving. And by the morning, it's already out of your system. So it gets in, does its work, and gets out. That's the way it augments. Remember what I said earlier? It augments, it helps your own system work better. So it augments your pulse of growth hormone that generally happens in deep wave, or what we'll call SWS, or slow wave sleep. So that is a big difference with growth hormone. And then using human growth hormone, yeah, it's prohibitively expensive, anywhere from 1,000 to 1,500 a month.
So
But it can
expensive.
cause a lot of other issues. It can cause, like, what we call growth gut. You saw that a lot in bodybuilders. The bodybuilders that have a six-pack abs, but their belly is out to here.
Hmm.
That's because their intestines are about that big around. Also from, growth hormone abuse, you would see in some cases they would get a split between their teeth because their actual skull would grow, and they would actually get like Cro-Magnon. Their actual, like, skull would grow. So there's a lot of issues with human growth hormone, and, in all honesty, like, it has its place, post-surgical recovery, but the safer bet is always a growth hormone peptides, because there's no real issues with them.
Well, we're noticing that Trey and I have been on it for about a month. We're noticing we sleep really, really well,
Mhm.
and we are noticing changes in the gym,
Mhm.
our fitness, and our recovery.
Mhm.
So, yeah. And then the sermorelin, that one helps to build muscle.
Mhm.
Wonderful peptide for women, especially
Mhm.
women in their years have used it. Maybe they were suffering from sarcopenia, or they had
Mhm.
loss of muscle tissue. I mean, if you can get some peptide in grandma, go for it,
Yeah.
right?
Yeah, one of the standards of care
Hmm.
now is actually with GLPs is they're recommending adding in sermorelin or tesamorelin. Like, it'll literally say, if they're going to use, if their BMI is high and they recommend a GLP, like, consider using sermorelin or consider using tesamorelin. So that is one of the new standards of care to prevent, some of the sarcopenia that they say can happen. But again, it's not specifically from the semaglutide. There's nothing in semaglutide or any of the GLPs that actually target muscle loss. It is from a calorie restriction that they impose from not being counseled properly. Because if you eat enough protein and you resistance train, we see great results with all the GLPs.
Absolutely. Okay. And for sleep, we have a new peptide for sleep. What is that called?
DSIP. So deep sleep inducing peptide. It's been out for a really long time. It just increases um, your deep wave sleep. And I can actually see it. I'm looking at it now, but I can actually see it in, like you can actually see the difference in your aura ring. Like,
Uh-huh.
I sleep well, and I'll be in my 80s, an 85 is a crown and aura of anybody that has an aura ring, and it's good sleep. But I'm consistently in my mid to high 80s, but like with a DSIP, you can go into the 90s, like, quickly, like very, very quickly.
How many minutes are you averaging more with your DSIP peptide?
About 45 minutes to an hour more of deep sleep
Okay. Awesome.
versus not using it. That's me personally, but I also do a lot of things to kind of optimize my sleep already.
Another peptide, the GHKCU copper
Yeah.
peptide. Can you
Yeah.
tell us about that?
Yeah. So GHKCU, it really works by increasing what we call type 1 collagen and elastin. Elastin is, the part of our skin that kind of, gives us a snapback. But basically, like we talked about as a peptide, it's just a mixing of a few different amino acids with a copper, peptide added at the end. So plasma levels decline with age. So we see it. So we have it naturally occurring in our body, but it primarily works in kind of skin regeneration, anti-aging. A lot of people are using it in anti-aging medicine. I don't really like to use the word anti-aging because we're all going to age. We can't really anti-age. We can anti-decline.
Yeah.
We slow decline, right? So I like to really call it, anti-decline or slowing decline. But again, it stimulates collagen, elastin production, improves like the skin's thickness, which again, look what happens if that's not protected. The skin gets really crepey. All of us have had like a great grandma that has that really thin, crepey skin. They lose thickness, firmness, elasticity. It reduces, fine lines, wrinkles, photodam. That's from the skin side, but like it does have very potent anti-inflammatory. It really works by modulating what we call inflammatory cytokines, and it can accelerate wound healing. That's why a lot of people are using it. Also, per surgical for wounds, helps like tissue, like speed up tissue remodeling. So like we see that with especially bigger scars. You can see that hair growth support. A lot of people are using it for hair growth. So it actually stimulates hair follicle activity. So what happens a lot of times is your
You
follicles.
don't take it, do you?
I don't need it. Yeah,
I'm
I
kidding.
can use it for the skin, but I've actually joked with my wife like, babe, I'll grow my hair back. She will not let me grow my hair back. She likes it like this. So
If I came into your office and you looked like you had a chia pet on your head, I
yeah,
think I don't know what I would
yeah,
do. Okay,
yeah,
listen.
yeah.
All you have to tell us women is it going to help cellulite and firm up our thighs because we will all buy stock in this.
Well, it'll help reduce the appearance of cellulite. So cellulite below the skin is going to be more the size of fat cells, right?
Hmm.
So we don't gain or lose fat cells as we get older. They either just become bigger or smaller. Like the burning fat, notion, it's kind of been contested. But it will definitely like tighten the skin and reduce the one of the reasons that a lot of people um like the appearance of cellulite is higher is because you notice it. I mean, if you don't notice it as much in very, very tight, firm skin. You just don't. Like the firmer the skin, the tighter the skin, the less, the lower the body fat. So it's gonna really help with the appearance, not so much the amount of
Okay.
yeah.
Well, there's a lot of people that I've talked to who have lost a significant amount of weight on peptides,
Mhm.
and they are asking about some of the extra loose, saggy skin that they have.
Mhm.
And we have talked about the GHKCU copper peptide
Yeah.
to
And also
assist with that.
topical actually works really, really well too. So there's a lot of tricopper peptides. Ellie has a really good topical skin one that has the GHKCU peptide in it that you can put
Mhm.
topically. So it works really, really well inside and out. Because that skin, the skin lotion that Ellie has works really, really well. My wife actually really likes it. I use it. So
I can tell.
yeah,
It's looking
yeah,
real
just shine.
smooth
Yeah.
right there.
Yeah,
Okay.
7 years old. You can't even tell.
So another category of peptides is sexual health. So I'm gonna make you
Yes.
uncomfortable here.
Yeah, not at
Okay.
all.
So tell me, we have some different products. We have the PT 141, which is an injection peptide, and then we have a couple of different nasal sprays, and we have a thrill pill.
Mhm.
And what would be the difference and how would somebody choose?
So it depends on what they're needing, what they're and I'll say suffering from, but um what the issue is, right? So there are a handful of women that I put on hormones and their testosterone goes up and their levels look good and they still come in and go, hey, like I still don't have a great libido because for
Mhm.
men it's very, very highly testosterone driven. So if I give a man testosterone and raise testosterone, man, his sex drive goes up. For women, there's a hormone component, but there's also a mental hypothalamus component. So PT141, again, for people to understand, PT141 is not just this kind of random peptide. It's been FDA approved. There's a brand name called Vyleesi. It's under the brand name Vyleesi, but it's bremelanotide. So bremelanotide it's the same, it's PT141 is bremelanotide. It's a melanotan derivative of a different peptide, but PT141 has been FDA approved for a long time, but it's more for women's sexual health. They call it women's Viagra. So if a woman still has like a desire issue, a sex drive issue, now again, women are also very, very, very emotional driven. So a guy, I can raise testosterone and he's ready to go, right? A woman needs to feel loved, protected, safe. There's all those
Yeah.
emotional components because if you've been at home all day long watching kids running, cleaning the house and doing all this, and then you're exhausted, and I walk in and I'm like, "Hey, I'm ready, babe." You're like, "Cool, awesome." So there's that emotional component,
Yeah.
but the PT141 really helps to work in the woman's hypothalamus to help with sex drive from a mental capacity. Now, PT141 also works very, 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 very well for men as for ED, because it can really, really, really help with erectile function, and which varies, but when you start talking about like the thrill pill with a tadalafil, the mixture of it has a mixture of tadalafil, oxytocin, and PT141 in it. And men and women can use that. The tadalafil, it does work. It's not just an ED men for men, it works for women, increasing blood flow because a lot of women's satisfaction is from clitoral blood engorgement, and so if you don't have a lot of like blood going to the clitoris, like you're just not going to have any sensitivity.
Hmm.
And then with age, that also happens as hormones start to decline, the clitoral hood actually starts to, extend out over the clitoris and covers that. So there it's kind of hidden. So a lot of times like the tadalafil or any kind of, vasodilator helps to help that, protrude a little bit to where it increases sensitivity. So the PT141 oxytocin mix. Oxytocin is what we call the cuddle hormone. So it enhances orgasmic potential for men and women. So it also helps like connectivity and just the feeling of like closeness. So it just depends what somebody's going to use it and need it for. If somebody doesn't want to inject, they have the PT141 nasal spray, and that is also has a really good uptake. And so I've had some women and men that like they just are needle phobic and are not going to inject. Well, you can use it as a nasal spray as well.
Okay, so the alternative to the injection would be the nasal spray.
Yes.
And in the PT141, is there tadalafil and oxytocin in the injection or no?
No, no, this
So that's only
PT141,
in the
that's in the
thrill
thrill
pill.
pill. Yeah.
Okay. So how long after you take your injection or nasal spray or thrill pill does your husband start looking like a pork chop?
About 45 minutes to an hour. And
Listen,
then
I'm here to make everyone laugh too, okay?
yeah,
We got to have fun on these Zooms. Okay.
yeah.
About
Well,
45
and
minutes to an hour?
yeah, yeah, about 45 minutes to an hour. And but it lasts. It can last for and some people up to 72 hours. That's why like when you use PT141, when we inject PT141, it'll say on the directions, it'll say, use, twice a week because you can do it regularly if you kind of always want to be ready, or you can use it as needed, 45 minutes or so before sex. So, but yeah, it works really, really, really well. Here's the thing is, whether people like to talk about it or not, like sexual connection, sexual health is extremely important for overall health in a in
Right.
a in a in a in a good like just monogamous marriage is just extremely, extremely, extremely important to continue like in connectivity and closeness with your partner.
Well, would we speak about longevity? We're
Mhm.
not just talking about one particular peptide that points to a life of fulfillment and longevity. We're talking about your quality of sleep, the way that you feel walking through your home and taking care of your family, your sexual health as it relates to your closeness and your relationship. I mean, at
Mhm.
the end of the day, you could be eating all the healthiest foods in the world and lifting weights and your exercise on point. But if the rest of your lifestyle and your relationships are terrible, it doesn't
Mhm.
matter. It
Yeah,
doesn't
my
matter.
five, and you know this because you see me. I can't see it. My five are, medicine likes to kind of position itself like this, right? Like we're number one, I just have a pill for every ill, right? And medicine's really failing in that it really should be like this, meaning it doesn't matter what medication or hormone or supplement I prescribe if the basics aren't taken care of. Diet, nutrition, hydration, exercise, activity, sleep, emotional, spiritual, mental health, and then medications, hormones, supplements. Now, they could all feed back, right? Because if you're hormonally depleted and you don't feel well, you don't have the drive to like,
Hmm.
exercise or eat well. And, but all that to say is, I do not ever want anybody to think that all you need is just peptides, all you need is just hormones, and eat a poor diet and and live a poor lifestyle. You're gonna get halfway there. You're not gonna feel fully alive.
And before we go into talking about safety and just where we're getting our peptides from,
Yeah.
when you just said that peptides are not just a free pass to just go get, you know, a kid's burger at McDonald's. We are looking for long-term lifestyle changes. And the conversations that I've had with some of the clients that I have on peptides, we have spoken very clear about, I said, look, the goal here is to make long lasting lifestyle changes. We're not just in here to do this short term. If you are a hoarder in your home and you are so far overwhelmed, you're going to need a crew to come in and help you. But it's
Mhm.
up to you to maintain it. So
Mhm.
you've got to learn and figure out why you were there in the first place and correct this. But you're going to have somebody or something helping you along the way to hold your hand.
Mhm.
And that's how it is for at least the GLP peptides. And of course, I mean, you can't just take the Cimarelin and Tesamorelin and Ipamorelin and expect your muscles to grow. You're going to have to be lifting weights.
Yeah.
But we want everyone to learn to eat properly and eat enough. And you had told me the other day, the best dose is the one that just takes the edge off the appetite, not where you're feeling sick or anything like that or have a headache, just
Mhm.
the edge off of your appetite.
Mhm.
Cut back on some of those addiction signaling in the brain and then work towards that super healthy lifestyle, and the peptides can help get you there.
Yep.
So
Yep.
tell us about sourcing and why we should be choosing a company like LEMD to get our peptides
Oh,
from.
oh, yeah, this is a huge sore subject with a lot of people because every other feed, every other post on your feed is another research peptide site. So understand that the FDA is cracking down on a lot of these research peptides, and every day there's a new one that pops up and they go away. And the ones that aren't like huge market, they don't have a large piece of the market. They feel like they're safe, but they show up and close down, show up and close down. So the biggest one in the United States, which was Peptide Sciences, and I'm talking about they were making millions a month. They shut down 3 weeks ago, or should I say they were shut down? They were given the choice, shut down or we'll shut you down by the FDA. You're not going to tell me that they voluntarily decided making millions a month to shut down if they weren't, there wasn't something serious going on, right? So the big difference with all these research peptides, I am so tired of all these experts telling me that, oh, well, we test for purity and we have a COA. COAs don't, certificate of analysis doesn't mean anything. So what's the difference, right? There's 503 pharmacy, which is what Ellie has in Clover, and there's gray market peptide sites. Okay. The difference is that 503s are registered pharmacies. They're legitimate medical supply. Okay. So it's a regulated compounding pharmacy operating under US law, 503A, 503B. The key difference is that 503s, like Clover, they have regulatory oversight. They're governed by the US FDA, especially 503Bs. 503As are also regulated by the state boards of pharmacy. Okay. Sterility and safety standards are way above what research peptide sites are. So they have sterile compounded standards, they have clean rooms, they have validated processes, and they have to have endotoxin testing. So you'll hear a lot of these peptides say, oh, we do endotoxin testing. Cool. Like you can say that, but there's nobody looking over their shoulder making sure they're doing it. And if you're using a research peptide, you're taking it on your own, you're on faith that you're going to inject something and not get an abscess or not get some kind of type of systemic infection. And and they tout, well, it's cheaper. Well, yeah, you get what you pay for because they don't have all the regulatory demands that a 503A has to. They do batch testing, 503A, Clover, verified dosing accuracy, lot tracking, and recall capability. So like if something happens, you have to have the ability to do recalls because you have to have lot numbers. Research peptides don't have that. Okay. And and they're designed for human use. Okay. So they're produced specifically for like patient care. So the different types, like I was saying, there's 503A, 503B. You and I ran into that, really arrogant doctor who thought he knew and he was actually wrong. 503A is just there's patient specific compounding, which was what most clinics use. Okay. 503B, they outsource from facilities, but they are still regulated by FDA. Okay. So it's not one's better than the other. It's just the sourcing. 503As do more bulk. Those are the ones where the clinics buy it in bulk and then they upcharge the patient a whole bunch. And then you come into the office, and I don't like that because it looks like the clinic is now a dispensing pharmacy, and that's not cool.
Wait, that's the 503B pharmacy.
Yes.
Yeah, you said A. Okay.
Yeah. No, 503A is patient specific. Like I have to send in a prescription. That's what Clover is. 503B is like they outsource, they do it in bulk. Okay. Gray market peptides, in contrast, okay. You'll hear a lot of online vendors, they'll just say, oh, we're for research only, not for human consumption. So that's the issue, right? So they're protected. They'll sit there. You can't, if something happens and there's a negative side effect, especially with like a GLP, number one, there's nobody to call. If you look at them, there's no customer service. You can't call anybody. You can't sue them because they'll come back and just say, hey, well, why are you using it? It says not intended for human use. So they're like protected. They're like, hey, use it, but it's not intended for human use. But these are the peptides I use, but it's not intended for, so it's like the circular conversation that they have. So the difference with gray sites is there's no regulatory oversight. So they're not held to the same FDA standard. I do not care how much they claim and say, and the purity is good. They can say what they want. They don't have to, they're not overseen by the FDA. There's no sterility guarantees, so they may not be produced in sterile environments. Dosing inconsistency, this is the biggest one. Dosing inconsistency. So there's been a lot of third-party testing that has been done. Dosing inconsistency. So there's independent dosing has shown that they've been underdosed, overdosed, or have contaminated products. So you're injecting yourself with something that might have endotoxins, no accountability, right? So there's no lot tracking, there's no recall system. And why? Because they're doing that intentionally. They can't have a recall, they can't have a tracking system because it's not intended for human use, right? So there's no clinical responsibility. They're in there like trying to make a quick buck. They're striking while the iron's hot. That's what they're doing. And literally, if you look, every other post is if you like talk peptides in your phone, like you'll start having peptide sites. But there's a legal ethical risk. From a provider standpoint, I cannot in good conscience recommend any patient to go to a peptide site because of a lack of regulatory oversight. So testing a vial, like they say, because they'll say, we've tested all our stuff. They can, again, testing a vial doesn't replace regulated manufacturing. That's the big difference. Okay. And with EllieMD, I feel completely safe that I can send them to EllieMD. It's overseen by a provider who prescribes, and then it comes from a licensed pharmacy. So 503 pharmacies, medical grade, regulated, patient safe, gray market, unregulated research materials that carry a lot of risk. And you do with that info what you will.
It's definitely a wonderful resource for you to have as a physician that's really busy with hormone replacement therapy, lots of patients coming through the door. People really need some individual attention when it comes to peptide use because they have a lot of questions. Can I take it with this? Can I take it with that? What about this? What about that? One of the things I love about EllieMD is that the patient can actually go into their patient portal and ask a million questions to their provider. So for
Mhm.
you, it cuts all that out for you.
Yep. Yep.
And they can go in there, ask the questions, and then they also have a community of support.
Yep.
So they can go into, we use Facebook groups. There's a ton of educational material that's produced every single week. Your office doesn't have to do any of that. You can just point, that's what you did with me. And just to, we're going to go into a few testimonies. I came to you in December. I told you that I wanted to try tirzepatide. You sent me your link. I went on there and I ordered my GLP-1 slash GIP. That's what I got, and I got my peptide, and I was very impressed with the process. At first, I didn't really have my dosing right and I did not like the way I felt, but I knew that so many people had such incredible benefits, especially for people with methylation issues like I do, being somebody who has some compound heterozygous for MTHFR. A lot of people, I mean, 40% of the population has it. Not everybody produces or shows difficulty in their life with it, but I sure did. And from pregnancy to everything. So I wanted to try it for that and for inflammation. So I lowered my dose. I talked to my provider and I said, hey, I'm going to lower this by half. They said, absolutely. Lower it by, go down to a quarter of the dose. So my starting dose said to do, I think it was 25 units. I lowered it down to 5 units, actually. I lowered it down to 5 units. And then I was able to creep up from there. I'm currently on 7 units. And we just talked back and forth. It was great. I didn't have to bug you and email your office. I was able to go in and do it. And then what I noticed is that within 2 weeks, I had lost 5 pounds of inflammation. I've kept it off. But one nice surprise, and I still haven't admitted this publicly, I did in a small group, but I have not had migraines. And I
Mhm.
don't understand why, but there's something that's happening because migraines for me were due to a lot of stress. And something happens in the middle of the night when you get migraines first thing in the morning. It has to do something with the cortisol and stress response and insulin. And it's a whole little thing that I don't quite understand, but I am very happy to say that my migraines have gotten better. My insulin, sorry, my histamine sensitivity. A lot of people are realizing they have strong histamine sensitivity. I'm not having the same reactions to foods that I did before. I've been allergic to chocolate my whole life, and I have started to eat some chocolate, which is like, that's amazing for me. So I still haven't drank alcohol. I have not been able to drink alcohol. Well, I quit when I was 21 years old, but anyway, I'm noticing all those things, and I'm very grateful. So let's ask. I have Janelle. She has a wonderful testimony. So Janelle.
You know what? I was an athlete. I always stayed pretty trim and then, hit my 50s and I felt like Tim Allen, on that Santa Claus movie where he just kept gaining, gaining, gaining. And I was working out and eating right and doing everything. And at the time, I was really struggling with my asthma. Um, I was having to take the maximum dose of inhalers. They sent me home with a breathing treatment with a nebulizer. And I was still suffering. And when I went into her office, my doctor, she was listening to my lungs and she said, Janelle, I can hear the wheezing. Like, you need to go on steroids. I said, I don't want to go on steroids. I'm fat enough. This is out of control. And she didn't offer me anything other than steroids because this is a regular doctor. But then a friend of mine who was a functional health doctor said, Janelle, you should go on a GLP-1 because and I was having trouble with my thyroid as well. And she said, autoimmune disease, and a lot of these are going to be helped from your inflammation going down, even if you don't lose weight, but you probably will, you'll love losing the weight too. So I went on it and I lost 40 pounds, tons of inches, lots of inflammation. My asthma's basically gone. I have needed no medication. It's been almost a year now that I've been on it. I don't need anything. I can breathe fine. And my thyroid medication, I switched over to Armor, which I like better than what I was on before, and they've lowered it 3 times. And I've never had it lowered. I've always been on the same dose. So I look better. I feel great. And I was so passionate about it that I signed up to do it. And of course, all my friends were saying, Janelle, what are you doing? So, it's just the easiest thing. You send it like you were saying, like you do, Dr. V, you send your patients there. Well, I send my friends there. I'm like, yeah, well, I'm not a doctor, but here's the doctor, here's the link. And so, now our team is hundreds and hundreds and hundreds of people, and we've helped thousands with customers. And I get before and after pictures and health testimonies, several times a week. And it's been a blessing. The products, the company, the friends I get to make, you, Amy, it's just been fantastic.
Awesome. Thank you so much. That's a wonderful testimony. I have a customer that, or client, I should say maybe. She has been addicted to THC for many years, and she has almost completely she's completely stopped, but this is the longest that she's ever gone. And because of the THC that she was using for anxiety, it would cause her to crave sugar, and then because of the sugar cravings, she gained weight. Because she gained weight, it caused insulin sensitivity, and because she had insulin resistance, and because she was in insulin resistance, she was having cholesterol issues and sleep issues, and get on her way to type 2 diabetes. I mean, and it all stemmed from that one addiction.
In my office now, I have literally a tissue box because there's so many women that come in that cry because they're so happy that they're the same weight they were in high school. And here's the thing is they were eating well. They were on hormones, they were training, they were doing all these things. The biggest group that I see that's helped across the board is my postmenopausal women transitioning, because you'll have my women, and again, perimenopausal, right? So a lot of people just talk about menopause. That's at the very end when estrogen drops. But the truth about it is that like hormones start to drop 10 years before the onset of menopause. And unfortunately, like a lot of docs, they don't recognize that. So, hormones like testosterone, progesterone will start to drop in women way before estrogen does. And a lot of times they won't replace their hormones until estrogen finally drops and they're in the throes of like hot flashes and night sweats and all kinds of things. They feel horrible. But what I've seen is, my women that kind of are transitioning, they are, I'm eating well, I'm exercising, I can't stop gaining weight, I don't know what it is. And then, GLP, you go on a GLP and all of a sudden, like they feel better. So that, like, to Janelle's point, that is what we see a lot of. And I kind of mentioned that and alluded to it earlier. The really cool thing that has always surprised me about peptides is that, you can start them for this and they help with this over here. And they help with this. They help with all these other things that you didn't intend for them to help.
Mm-hmm.
But they help because why? They're signaling molecules. They help you signal better. They help the transmission. They help the communication of your cells, which is why she's been able to lower her thyroid, which is why, because here's why. Let me explain that on thyroid. Okay, if you have classic hypothyroid, which is you're not getting the signal from the TSH, you're not getting, your thyroid stimulating hormone, and your TSH is very high. That is very, very, very difficult to fix. And most of those end up on being thyroid the rest of their life. Now you can lower the dose and over time, but the majority of people that we're dealing with today that I see are what we call type 2 hypothyroid or subclinical hypothyroid. They call it type 2 hypothyroid. And that is where the TSH is normal. You're sending the signal, but you're not able to convert T4 into optimal T3, free T3. And that's, your free T3 is what you feel. That's what gives you the energy, the metabolism. There's a lot of reasons: autoimmune, insulin resistance, diabetes, low testosterone, low ferritin. There's a lot of reasons why a person cannot convert T4 to T3. So a lot of times, so if you have a normal TSH and a T3 is very, very low, you will have all the same signs and symptoms as hypothyroid, every single symptom. So now you fix the signaling with peptides, and all of a sudden you lower the inflammation from autoimmune, lower the inflammation from other issues from the insulin resistance. They can start lowering their NP thyroid or their armor thyroid dosing or their compounded thyroid dosing, because their cells are speaking to each other better, and there's a better transmission. So that is what we see with a lot of peptides. So they do way more things than we actually are understanding and give them credit for. But all I can say is EllieMD has allowed me to extend my reach, because, like you said, I am very busy. Like, in my practice, I'm extremely busy, but I've been allowed to reach a lot more patients now, through peptide therapy with EllieMD, where I don't have to spend all the time. Now, I'm always there. Like with you, I'm always there. If you have a question, you reach out,
Right.
email me. I can always, like, if you run into some, issue, but the communication with the EllieMD providers is amazing, and they're providers. They're not an influencer that's saying, I use this, buy my stuff, online. And so, yeah, I've really, really enjoyed being with EllieMD, and I think it's just going to grow and grow and get bigger and bigger. And they're poised to kind of take over the entire peptide market in the US.
So anybody who is watching this video or on our Zoom, the way that you can get peptides is you can go to the EllieMD website link that someone had shared with you. And the best thing to do is to log in. So you just create a username and a password. When you do that, it opens up more peptides for you to view, and go through all the different peptides in the different categories that you want to look at, and just read about them. There's so much information on each peptide. Going down and just scrolling down on the page, there's lots of information. Narrow it down, and then you can go on and you can order whatever it is that you want, and you'll have an intake form. So as soon as you click that you want that peptide, there's an intake form. You fill out that intake form, and that's where you're going to put if you have some concerns, okay, I'm on this medication, or I've had this issue, or whatever it may be, you're going to put that there. And then they are going to have a provider that's very, very soon look over that, and they are going to either approve it or deny. And sometimes it is denied. Sometimes it is, but they're going to either approve or deny, and then immediately that order or that prescription is sent over to Clover X Pharmacy, which is the EllieMD partner pharmacy. It's not owned by EllieMD. They are partners and exclusive. We have exclusive rights. They only fill peptides for EllieMD, and then it is filled through them. The person who owns that pharmacy is next level intense, very intelligent, and he loves to get products out very quickly. So those products are going to come out very quickly to your home, and then they're going to arrive at your door. And if from that point, if you have questions, then you can go on your patient portal. You can ask them. You can ask the person who referred you to EllieMD. They may send you back to your portal. But yeah, that's pretty much the process, and it's easy to do, and it's a wonderful company, and it's been a fun journey.
I'll be speaking at the first convention here in the Woodlands in June. So I'll be going over all, like, really in depth on all the peptides. So hope to see, like, everybody that, here at the conference. That's going to be really, really good. I mean, it's going to be great info. I'm really looking forward to sharing info, but we'll be able to go really, really deep into the information and do, hopefully some Q&As. There's a lot more to understand about peptides, but look forward to seeing everybody there. So thanks for having me on.
Awesome. And if you are interested in becoming a brand partner with EllieMD, the more the merrier. You can talk to the person who invited you to this Zoom. You do not have to be a provider or someone in the health and fitness field. everybody is looking to get healthy now, and you're literally sending them a link. It's about pointing them to the right direction. All right. Thank you so much. And we'll see you all in June, hopefully. And we'll talk to you soon. Bye.
Bye.